question, please let me know in the comment box below. Thank you. Bladder tumor procedure. What should do prior to bladder tumor procedure? If you are taking warfarin, Eliquis, Geroto, or Badaxa, I would recommend you should recheck your INR about 2 weeks prior to the procedure if you are taking warfarin. If you have a therapeutic INR result, then you may need to hold the warfarin 4 to 5 days prior to the procedure. If your INR result is elevated, just slightly high, then and you have a stable INR history, then you may need to adjust your INR a little bit to make sure it get back to the therapeutic range. Then you hold for 4 to 5 days prior to the. If your INR result is critical, probably you need to fix that INR by holding your warfarin and reduce the dose to make sure the INR back to the therapeutic range, or plan for the procedure. Anytime hold your warfarin more than 3 days, you need to consider switching to the low injection if you have a recurrent blood clot or stroke history, and you have strong risk factor of having blood clot or stroke, then you need to put with low injection of warfarin for more than 3 days. Your doctor who manages your warfarin or the anticoagulant will give you a separate instruction for the low reaching. You should follow the instruction closely to understand when you need to stop low injections, when you need to stop them before the procedure, when you need to resume them, when you need to stop the low injection quickly. If you are taking the Eliquis, Geroto, or Badaxa, you should check your kidney labs. Make sure it's up to date. If they are more than 3 months old, then you may need the labs. If you have kidney failures or kidney disease, then you may need to consider updating your lab sooner than 3 months. If your kidney function is within normal limit, then you may need to hold for only 2 days prior to the procedure. If your kidney functions is not normal, as your creatinine clearance less than 50, you might need to hold more than 2 days. And you might need to delay resuming your Aliquis Yeroto or Badaxa. You should check with the surgeon or proceduralist. Make sure if you are safe to resume your platinum medication after the procedure. If anything different, I need to discuss with your doctor who manage your platinum medication or anticoagulant. If you have any question, concern, please let me know in the comment box below. Hello, what should you do prior to colonoscopy procedure if you are taking platinum such as warfarin, Aliquis, Yeroto, or Badaxa? For warfarin, you should recheck your INR prior to the procedure. If the INR is therapeutic, then you should hold your warfarin for 4 to 5 days prior to the procedure. You might need to be bridged with the Lovenox injection if needed. If you have recurrent blood clot history or recurrent stroke history or any strong risk factor indicating you have high risk of blood clot or stroke when you off warfarin more than 3 days, then need to be bridged with the Lovenox injection of warfarin for more than 3. If you have a very elevated INR, like critical INR, then you need to hold your warfarin or and reduce the dose of warfarin to get to the therapeutic before you can plan for the procedure. If your INR slightly high, then need to adjust the dose and recheck in 1 week if needed, or should adjust the dose and plan to hold for 5 days or so for the procedure. If you have long enough for breaching, then you should follow your doctor who your doctor who manage your warfarin for the anticoagulant. Make sure you understand when to start the Lovenox injection and when to stop before the procedure, when to resume the Lovenox after the procedure. If you are taking Alaquix, Geroto, or Badaxa, you probably need to check your if not within 3 months. Your Alaquix, Geroto, Badaxa may need to be helped for 2 days prior to colonoscopy procedure. If you have a normal kidney function, if you have a kidney disease or your kidney function is not normal, like your serum creatinine not within normal limit, then you might need to hold your warfarin. Excuse me. Then you need to hold your Eliquis, Geroto, or Badaxa more than 2 days. When you need to hold your Eliquis, Geroto, or Badaxa more than 2 days because of your kidney function issues, then you may need to delay to resume patient. So typically you resume Eliquis, Geroto, or Badaxa 1 day after the procedure. But if you have kidney problems, then you may need to resume your Eliquis, Geroto, or Badaxa 2 days or more. So you need to follow your doctor who manage your warfarin or your anticoagulant and your surgeon or proceduralist. You don't have to reach when you hope for your Eliquis, Geroto, or Badaxa. You should check with the surgeon or proceduralist to make sure when it's safe to resume your platinum medication. If your surgeon or proceduralist delay to resume, you should report to the doctor who managed you or anticoagulant recommendation in the systems. If you have any question, concern, please let me know in the comment below. transurethral resection of the prostate, TURP procedure. What should you do prior to transurethral resection of the prostate procedure? If you are taking a platinum medication, check warfarin, Eliquis, Xarelto, or Badaxa. If you are taking warfarin, I will recommend you should recheck your iron about 2 weeks prior to the procedure. If you have a therapeutic INR, then you should hold for 4 to 5 days prior to the procedure. If your INR is elevated, I need to fix your INR, come back in 1 week to see if it improved, and plan for the procedure. If you are critical, you need to hold warfarin, reduce the dose, and come back in 1 week, check your INR, plan for the procedure. Anytime you hold your warfarin more than 3 days, you may consider reaching with the lobe injection if you have a history of recurrent blood clot or stroke and strong risk factors of having blood clot or stroke. If you have to reach with the lobe injection, you should follow your doctor who manages your warfarin or the anticoagulant instruction closely to understand when you need to start the lobe injection, when you need to stop before the procedure, when you need to resume it at the procedure, when you need to stop the lobe injection quickly. If you are taking the Eliquis, Xarelto, or Badaxa, you should check your kidney function, your renal labs. Make sure you are up to date. If your labs were done more than 3 months ago, then you might need to repeat. If you have kidney disease, kidney failure, you may need to repeat the lab sooner. If your kidney function is normal, you need to hold for 2 days. If your creatinine clearance less than 50, to hold more than 3 days. Delay resuming. You should check with the surgeon or proceduralist to see if you are safe from resuming the platinum medication. If any different, you should check on doctor who manage your platinum medication or the anticoagulant. Make sure they have the updates. If you have any question or concern about this procedure, what to do prior to this procedure, and or if you are taking platinum medication, please let me know in the comment box below. Thank you. spleen surgery or the vascular surgery related to spleen. Prior to spleen surgery, what to do prior to spleen surgery if you are taking warfarin or Eliquis or Xarelto or Badaxa. If you are taking warfarin, you should recheck your INA in about 2 weeks prior to the procedure. If your INA is at therapeutic, you should go ahead and hold your warfarin for 4 5 days prior to the procedure. If your INA is a little bit elevated, you should adjust the dose a little bit and hold your warfarin for 4 to 5 days prior to the procedure. If your INA is very elevated or critical, then you need to hold your warfarin and reduce the dose and come back in about 1 week. Make sure your INA improve, get back to the therapeutic level. Then before you can plan for the procedure. Anytime you need to hold your warfarin for more than 3 days, then you need to switch with the Lovenox injection. If you have a history of recurrent blood clot or stroke and strong risk factor of having blood clot or stroke, such as factor V deficiency. If you are taking the Lovenox injection rich when you off warfarin, you need to follow your doctor who manage your warfarin or the anticoagulant instruction closely. Make sure you understand when you need to start the Lovenox injection, when you need to stop the Lovenox injection before surgery, when you need to resume after the surgery, and when you need to completely stop the Lovenox injection therapy. If you are taking Eliquis, Xarelto, or Badaxa, you should check your kidney labs. Make sure they are up to date. If they are more than 3 months old, then you need to update the labs. For those people who have kidney problems, such as kidney failures or chronic kidney disease, they should get the update lab. They should get the update lab sooner than 3 months. If they have a normal kidney function, if your kidney function is normal, you should hold for 2 days and resume the day after the procedure. If your kidney function is not normal, your creatinine clearance less than 50, you might need to hold more than 2 days, and you might need to delay resuming your Eliquis, Xarelto, or Badaxa. You also need to check with the surgeon or proceduralist to make sure if you are safe to resume your platinum medication. When is safe? When you are safe to resume your platinum medication. If any different, you should update to your doctor who manage your warfarin, your anticoagulant. If you have any further question, please let me know in the comment box below. Thank you. liver surgery or vascular surgery related to liver. What to do prior to liver surgery if you are taking a blood thinner medication such as warfarin, Eliquis, Xarelto, or Badac. If you are taking warfarin, I will recommend that you should recheck your INR about 2 weeks prior to the procedure. If the INR result is therapeutic, then you should hold your warfarin 4 to 5 days prior to the procedure. If the INR result is slightly elevated, then you should adjust your warfarin dose a little bit and hold 4 to 5 days prior to the procedure. If you have very elevated INR or critical INR, then you may need to hold your warfarin and reduce the dose and come back in 1 week to recheck your INR to make sure your INR improve, turn to therapeutic range before you can plan procedure. So you should follow your doctor who manages your warfarin or anticoagulant closely to you have a appropriate plan surgery. Anytime you have to hold your warfarin more than 3 days, I would recommend that you should consider reaching with the Lovenox injection if you have a history of recurrent blood clot or stroke and strong risk factors of having blood clot or stroke, such as factor 5 deficiency or some kind of genetic. If you have to reach with the Lovenox injection, you need to follow your doctor or the anticoagulant closely to make sure you understand when you need to start Lovenox injection, when to stop Lovenox injection for the surgery, and when to resume the Lovenox injection after the procedure, when completely stop the Lovenox injection therapy. If you are taking the Eliquis, Xarelto, or Badaxa, you should check your kidney labs, make sure they are up to date within 3 months. If you have kidney problems such as kidney failures or kidney disease, then you need more update labs than the normal people. If your kidney labs within normal limits, then you should hold for 2 days. If the creatinine clearance not within normal limit, for example, if less than 50, then you may need to hold more than 2 days. You should resume your Eliquis, Xarelto, or Badac the day after the procedure if your kidney is normal. You should delay resuming your Eliquis, Xarelto, Badaxa if your kidney function is not normal. You may resume 2 to 3 days after the procedure. You should make sure safe to resume your blood thinner medication. If any difference, you need to talk to your doctor who manages medication or your anticoagulant. Do you have any question concern, please let me know in the comment box below. Thank you. For the dental cleaning procedure, what you need to do prior to dental cleaning procedure, if you are taking blood thinner medication like warfarin, Eliquis, Roto, Badaxa, so I would recommend that you should not hold a blood thinner medication for a routine dental cleaning. If your iron, if you're taking warfarin, you need to make sure you are stable with your iron level. You don't have clinical iron before routine cleaning. If you have critical iron, probably you need to hold your warfarin for a few days in order to get your iron to the therapeutic level. So avoid your routine cleaning if you just have the critical iron like over 5 or your iron over 6, or you have any kind of active bleeding when over or blood thinner medication. For the deep cleaning, if you have to have a deep cleaning in, on blood thinner medication, might consider to hold your warfarin. You need to check with your doctor who manage your blood thinner medication. They have to review your iron history, and then they will give you some recommendation on your warfarin and your iron history. Generally, if you have a stable iron history, then and then your current iron is therapeutic, then they might recommend that you hold for 1 day prior to the procedure. If your iron, if your iron is not stable and has the history of elevated iron, then they may recommend that you should hold for 3 days prior to the procedure. But they need to test your iron prior to the procedure, usually within 24 hours of the procedure. And then if you are taking the Eliquis, Yeroto, Badaxa, and then you don't have any kind of bleeding or anything, any active bleeding, such as nose bleeding, stomach bleeding, or blood in your urine, and then you might need to hold for 1 day prior to deep cleaning. And again, if your dentist, they are not concerned about your bleeding, and then they don't recommend you have to hold your blood thinner medication, then you should not hold your blood thinner medication. You don't have any concern about bleeding. If you are stable with your warfarin doses, and then you have a good history of your iron therapeutic for a long time, then you should follow your dental recommendation. If you have concern, you should always ask your doctor who manage your warfarin. Make sure you are safe from any procedure. Okay. If you hold your warfarin or your Eliquis, you should resume your blood thinner medication as instructed by dental. If you have any question, you ask your doctor who manage your warfarin when you resume your blood thinner medication. Generally, if you don't have any kind of bleeding, or if you don't have any instruction from your dental when to resume your warfarin, then uh, you know, your uh, doctor who manage work and might um, have you to resume your work and they uh, after the procedure, but you need to double check you are safe. prior to dental scaling procedure. So what should you do when you are taking a blood thinner medication, that warfarin, Eliquis, Xarelto, Adaxa? I would recommend you should not hold blood thinner medication otherwise as instructed by your doctor who manage your warfarin or your community clinic who manage your warfarin. Or your clinic who manage Eliquis, Xarelto, or Adaxa. If you are taking warfarin and you have unstable iron history, then you need to check your iron to make sure you are not critical prior to a procedure. So if you have a critical iron, you should hold your warfarin until your iron back to the therapeutic level or below your range, be safe for the procedure. If you are stable with your warfarin and you have a good iron history, but in range for a long time, then you may not hold your blood thinner your warfarin. Okay? If you don't have any active bleeding or any concern about bleeding, then you don't have to hold your blood thinner medication prior to dental scaling. If you have to hold your blood thinner medication prior to the procedure, as instructed by your dental, then you need to resume your blood thinner medication instructed. Make sure have a bleeding can control your blood clot or prevent stroke if you don't. If you take too long to consume for blood thinner medication. So as one way, you need to check your dentist or your oral surgeon to make sure that they have any instruction for you for the procedure. Let them know that you are on blood thinner medication if they have any instruction. If they have no concern, no instruction, then you should check with your doctor or the anticoag clinics, make sure they have a recommendation save the procedure. Again, I would not recommend take blood thinner medication before a dental scaling procedure unless otherwise as instructed by your dental. If you are not stable with your warfarin doses, you have unstable iron history, and you have the critical iron recently, and you should talk to your doctor or your anticoag clinic. Make sure that they give you good instruction what to do with your blood thinner medication prior to And then after the procedure, you resume your platinum medication as instructed by your dental. If you don't have any instruction, if they don't know what to recommend, then you should follow your doctor or your anticoagulant recommendation. Safe. Resume your platinum medication appropriately. If you have any further question or concern about uh, before dental scaling procedure, what you need to do, and you're on platinum medication. Thank you. Good Friday, everyone. I would like to talk about pharmacy law today. Um, a lot of patients and some pharmacists uh, confused about pharmacy law every day, especially um, retail pharmacists uh, and people who work um, at the chain pharmacy like CVS, Walgreens, Walmart. Um, they face with the pharmacy law every day. So I would like to talk some important pharmacy laws that may be benefits for both patients and pharmacists folks. So I would like to talk about Schedule 2 to 4 controlled substance prescriptions. Schedule 2 uh, is different uh, with Schedule 3 and Schedule 4 and Schedule 5 and the prescription only. So the Schedule 2, like oxycodone, um, you know, hydrocodone, morphine, uh, those medications, controlled substance, Schedule 2 or C2 prescription. So first I would like to discuss about day supply. Okay, so excuse me. So the day supply of C2 prescription, um, the maximum day supply for the C2 prescription is 30 days. But for some C2 medication, the maximum day supply can be 60 days, like for those medication or the dextroamphetamine or methylphenidate for the ADHD. So those medication um, can be 60 days supply. And some injectable infusion medication during the bumps, um, they may be okay for 90 days supply. So for these day supply limit is a different and vary state to state. So may need to check with your state law to see what are they supply limits for the Schedule 2 prescription. And the Schedule 2 prescription cannot be refilled. It's prohibited. So no refilling for Schedule 2 prescription. For some reason, prescription for Schedule 2 might be partial fill because they don't have enough medication in stock, so they out of stock medication, and in that case, the pharmacist may give you some partial fill, but it's very complicated to do the pressure fill. Pharmacists need to um, dispense the rest within 72 hours, and if after 72 hours the patient not come back for the remaining, then the pharmacist must report to the prescriber, the doctor who prescribes the medication. This little, it has some a complication if something happened after the partial fill. And then it not permitted patient request, so the patient cannot request a partial fill. The partial fill only occur if the pharmacy does not have enough medication in stock. So how long the Schedule 2 prescription is valid? Depend on state. Some state, it set the time limit like 30 days limit. After 30 days, the prescription is no longer valid. So you may need to get a new prescription for C2 medication if you cannot fill medication within 30 days. But for some medication, for some patients, like patients in long-term care facility, like a nursing home patient, or patient with a diagnosis of terminal illness, and the prescription may be valid up to 60 days from the day of issuance. So for the patient, the prescription can be filled within 60 days from the day the prescription was issued. So this is very important numbers and informations when you have the prescription for Schedule 2 controlled substances. You need to know some basic information to avoid, the prescription become invalid, and make sure you get enough medication, the total quantity, prescribed instead of a partial fill. If you don't get a partial fill within 72 hours, then you cannot get the rest of the medication. And remember to fill the medication within 30 days. No refills permitted. And then understand the state laws to make sure, if you have the prescription for dextroamphetamine or methylphenidate for the ADHD, and some injectable infusion bombs, the medication for infusion, then you need to make sure you fill the medication within the time limits. All right, if you have any questions, please let me know in the comment below. I'm going to talk a little bit about Schedule 3 and 4 prescription. So Schedule 3 and 4 prescription. There you go. Schedule 3 and 4 prescription. So again, the day supply, or state law, some state law is the maximum 30-day supply per single filling, or be spent at one time. Federal law say maximum 34-day supply per single filling. But only a 5 refill and 6 months. You only have 5 refills within 6 months from the day of issuance of the prescriptions. So after 6 months, you cannot fill the Schedule 3 and Schedule 4 prescription. Make sure you know the time limit. And only fill 30-day supply or 34-day supply per single filling. Okay, so as long as you have enough for medication for 6 months, if you have 34-day supply, then probably you don't have 5 refills, maybe 4 refills. So it might be we need to do some calculation of, or 6 months is equal to 24. Probably you have 4 refills if 34-day supply. For box refill, yeah, if the pharmacist unable to supply the prescribed quantity due to out of stock or the patient request, so it's different with the Schedule 2 or C2 prescription. C2 prescription, the patient cannot request a box refill. Okay, and then for state law, you might not exceed 30 days supply, and the total quantity in all box refillings may not exceed the total quantity prescribed. And then after 6 months, from the day of the prescription issue, you cannot do a partial fill or any refill, nothing after 6 months. Again, the prescription may be valid for up to 6 months from the days the prescription issued. So these very basic but important information all patients and pharmacists should know to avoid any arguments when the time that the patient needs medication but cannot be filled, or too soon to refill, things like that. Generally, pharmacists may dispense the schedule prescription maybe only 2 days earlier. Uh, if the patient want to get the prescription too early, they only do 2 day 2 days early for most of the scheduled substances. All right, so this is some pharmacy laws that it occurs every day, and then you know some a lot of patients they don't understand this why the pharmacist refuse to refill the medication too early, or why they cannot fill the prescription even though they have some refill remaining like that. And the pharmacy, if you already got the medication for the pharmacy. Right, if you have any question or concern about this pharmacy law, please let me know in the comment below. Thank you for listening. So, I'm going to continue some very important pharmacy law. This is just for patient information. Good to know this information when you have a prescription, get it filled at the pharmacy. So the last time I talked about Schedule 2, Schedule 3, and Schedule 4 controlled substances prescriptions. Now Schedule 5 controlled substance prescriptions, or C5 prescriptions. Again, you need to understand the days supply on the prescription. So no federal or state law regulating the quantity of this prescription, C5 prescription, or Schedule 5 controlled substance prescription. So no law saying how many they supply, maybe anything feeling, but any one time. For the refill, no specific or set time limitation. So for the C5 prescription, the law doesn't say how many days supply can be refilled. It's not like C3 and C prescription. It limited 30-day supplies. So but many states may limit refills of C5 prescription by refills within a 6-month period. It's like C3 and C4. C3 and C4 limits to 5 refills in 6 month period. So it depends on where you live. Your state may one set the limit, set the time limitation C5 prescription. The C5 prescription may be fracture fill. So there is no law regulating fracture fill for C5 prescription. But the total amount of all specific or set time